because I'm very aware that everybody's pretty time pressured. And today's going to be a fairly informal webinar, so please just use the chat function, or if you want to unmute and just ask questions, just feel free to do that. I also am not the absolute, expert in all things abstract writing, so I'm really happy for other people to chime in and give tips. These are just some tips that I have from having worked in this space for a little while. And I've also asked some of the higher performing abstract authors to share their abstracts with us from their 2022 conference, which they've all very kindly agreed to do. So we'll work through some of theirs as well. So hello to everybody, and thank you for being here today. My name's Claudia Virdun. I'm a senior lecturer in palliative and end-of-life care at Flinders University, and I'm also the Vice President of Palliative Care Nurses Australia. And my clinical career was really as a specialist palliative care nurse for a couple of decades, mostly around New South Wales regions. So I come with a very passionate palliative care lens. We're very excited about the upcoming Palliative Care Nurses Australia conference. We'll talk a little bit more about that. So I'm delighted that you've also joined today, because hopefully that means you're excited about the conference too and thinking about coming along. Before starting today, I did want to acknowledge the traditional owners of the land on which we meet from the varied locations we come from today. Today, I'm in Brisbane or Meanjin, and I acknowledge the Turrbal and Yugara as the First Nations owners of this land. And I would like to pay my respects to elders past, present, and emerging, and thank them for their care of our land and their willingness to share their deep history with us with such incredible resilience and compassion, despite so many wrongs over our shared history. So a friend and colleague of mine, an Aboriginal healthcare leader, Nicole Hewlett, explained to me several years ago that water, such as on the screen now, is a symbol of knowledge in Yolngu philosophy, and that the theory of Gunma is where streams of knowledges combine and lead to deeper understanding and truth. And she and I actually spoke together at our last PCNA conference about this concept, and this has actually been really important for me and something I've continued to grapple with, about how we can meaningfully support improved access to and provision of optimal palliative care across Australia. And Nicole mentioned the importance of the creation of foam, where the two waters meet, with these representing Aboriginal knowledge and Western knowledge, and the fact that to enable this foam to form, balance across perspectives is needed. So today I both acknowledge our traditional owners, and I also pledge to work hard to find ways to prioritise the creation of and the care of this foam, to really try to find the balance and see true change that will be meaningful for all. So I challenge each of us to think about how we can find the Gunma in palliative care, because I really do think collectively we can make a difference. See if that will move to the next slide. So today, I'll just check if anyone else has come in yet. Not yet. So the Palliative Care Nurses Australia Conference, it's coming up from the 31st of July to the 2nd of August, and it will be held in a hybrid fashion. So all sessions will be live streamed, and it will also be on site in Melbourne or Naarm. We do have a conference website, which is just listed at the top there. So pcnaconference.au. All of the information about abstracts, about the conference, about registration and so forth is all within that conference website. So do make sure that you check in with that website as you do this work, because that will really be pivotal as well for your success. Yeah, I'll just go like that. And a sneak peek into our program as it exists. Now, we've still got a little bit more work to do as we're developing the program, but we really do feel it will be a fantastic 2 days of connection and learning. And I really want to thank our program, our committee that is really working on that, which includes 2 consumer representatives, 3 clinicians or academics. So that's myself, Kate Swetnam, who is the lead for end-of-life care in South Australia Health, and Josh Cohen, who's a nurse practitioner in palliative care, and also 2 Aboriginal leaders in palliative care. One is a nurse practitioner in palliative care, and the other is a senior Aboriginal health worker. And really, with those of us on the committee, we've wanted to consistently prioritise, first of all, patients and families, Second of all, being really clinically relevant, the information that we have. And thirdly, that we do try to find this balance of perspectives across Aboriginal and non-Aboriginal people. And so really that has brought us to the following focus areas. So our overall conference theme is clinical excellence, connection and culture, the art of palliative care nursing. And the key plenary areas are these four. So we have 2 plenary areas per day, a morning session and an afternoon session. So day 1 starts with a focus on paving the way for improved access to and provision of palliative and end-of-life care for Aboriginal and Torres Strait Islanders. And then in the afternoon, we move to enabling family members to be valued and supported members of the healthcare team. And then the next day, the morning session focuses on the critical role of nurses in enabling improved access to and provision of palliative and end-of-life care across all care settings. And then the afternoon focuses on updates on clinical care delivery from nursing leaders in palliative care provision. Within that too, we have 3 workshops that will be run. One will be focused on complex communication. Another will be focused on paediatric palliative care. And the third one is also exploring the concepts more around this really enabling shared care with family partners in terms of palliative care provision. I'm just double checking no one else is needing to be admitted. So, and then in addition to those key plenary areas and also the workshops, we'll have concurrent sessions, 2 sessions of concurrent sessions in every day, and each of them will also be live streamed. And that is where the work of all of the abstracts will really contribute so richly, because all of your work will then provide additional clinical input to our program. So it will be interspersed across both days. So in terms of abstract submission, when you come into the Palliative Care Nurses Australia Conference website, you'll see along the top a number of different tabs, and one of them is abstract submission. So that's where you need to go to read all of this relevance information that I'll sort of allude to today, but you can read this as well in your own time. Everything on this website is the truth in terms of the way that we will manage the submission process, what we need in terms of the guidelines for abstract development and submission. And I'll also share with you today what the review criteria will be for the reviewers. So for every abstract that is submitted, that will be reviewed by 2 different reviewers, and they won't know the author of the abstract. So it's de-identified, sent to a number of reviewers, and 2 people independently review it and give your abstract a score. So in terms of some tips, the first one would be to really read carefully the submission guidelines. As I say, they're all online. And some of the really key things are on the screen here. So your title, you need to think about a descriptive title, and it has to be 15 words or less. And it's really good if that can be grab our attention as such, because I think the reviewers quite like that. When they see that, they can see straight away the relevance, the importance, the interest of this work to the audience. You then need to list the authors that are involved in this abstract. It doesn't have to be just one. There might be a team of authors involved, but if it is just one, that's also absolutely fine. And your affiliations, so who you work for, what your role is. And then the abstract, and this is, if you take nothing else away from today, I really, sorry, there's another person just wanting to be admitted. I really want you to take this away, that really the reviewers will be using the following headings for grading your abstract. So background, aims, methods, results, and conclusions. They will be relevant whether you're submitting work which is a research study, whether you're submitting work which is a quality improvement project or a project, or whether you're submitting work which is a clinical case study or a lived experience case as well. So it can be a little bit complex, I think, to write clinical case studies and lived experience case studies with these subheadings, but you still do need to use them. So I've had a bit of a discussion with our team about how we would suggest you maybe think about them, and I'll show you some of our thoughts in relation to that. But I do just 2 of the 3 criteria will really be rated, ensuring that you have these headings in place and are addressing them. So they are really critical for you to get to use and to get right as much as you can. And also you need to make sure that your abstract is 300 words or less. So again, there's one criteria which will be looking at the word count, and you do need to be able to meet that, which is quite challenging, I think, for some of the work that we do. As you work through the website as well, you'll see there's a number of presentation themes, and there's more than listed on here. That it goes down to 13. I just couldn't get it all on this screenshot. But so just try and find what you think is the correct theme for your work. If we don't agree, like, so say you put in an abstract and it's really well rated, but we don't think it sits in the theme that you've noted it in, that's okay. We will move it to where we think it needs to be. So this doesn't impact on your rating, but it is really useful for us in terms of the way we organize the program. Okay, I'm just, because of the way my screens are working, I can't quite see everyone. So if you have a question, please just take yourself off mute, because there's not too many people here today, and just interrupt me and ask away. So as I say, the format is really critical: background, aim, methods, results, and conclusion. So you do need to try and use those 5 subtitles and write in a relevant way to them. I also wanted to say at the outset that we are really open to having submissions about research studies, about improvement projects, and about clinical case studies, including lived experience case studies from consumer representatives as well. I do think sometimes writing abstracts can be more straightforward for those of us working in research. However, I really want our conference to be very inclusive across all of these 3 areas, because I really do believe that our audience will benefit a lot from hearing about really clinically relevant improvement projects that are happening, and also clinically relevant case studies. So although it can be trickier, please don't be put off by that. One thing that I have done to our reviewers is already noted this. So I just put all of what I actually wrote to them, but I wanted to note at the outset that the PCNA Conference Committee have noted our firm commitment to supporting both research-based and non-research-based abstract submissions, inclusive of research studies, QI projects, case study presentations, and lived experience presentations. We have asked authors to all use the same abstract guidelines and headings, but ask that you specifically review scientific merit in accordance with what is being reported to ensure fairness and enable presentations reflective of this diversity, given the clinical importance of all such information. So we are going to really try to be supportive across all abstract submissions. Now, the next couple of slides are a little bit messy, but they are our actual review criteria. So the first criteria, so there are 3 criteria. The first one is relevance to palliative care. So do you think this abstract will be of interest to the audience? So that's the question we're asking the reviewer. Does the reviewer think this will be of interest? And they either give you a 0, 1, 2, or 3. So not at all for some of the attendees, for most of the attendees, and for all of the attendees. And so this is a really important criteria. It can be quite variable. So if somebody was writing very specifically about perhaps care in the ICU, although that's highly relevant and I would say of interest, it may not be for all attendees, because some may be working in aged care or in the community. So even if you don't rate a 3, it might not be that your abstract is not great. And so we're quite aware of that, and we will be watching that in terms of streams. So if we got, for example, a lot of abstracts relevant to acute care, that would make a really good concurrent stream that is relevant to a really good number of people, as that's also relevant, say, for aged care or whatever we might see. Scientific merit, and this again, we are repeatedly noting that this is the criteria which is, I think, harder for non-research based abstracts, but still is I think there is a way to make this work. So again, if it's a research or an improvement-based project, we're asking, does the abstract show rigor in the design, in the implementation and the reporting phases of the study or project? If it's a clinical case study or lived experience presentation, does the abstract show rigor in articulating why this is important, the aim for presenting this story, how the information was collated, and the impacts of this on future practice? So that's what we're looking for. And sorry, I can see some of you are taking notes, and just to let you know, at the end, we will circulate these slides for you as well. So you will get all of the slides in an email later today. The third criteria is about presentation. So does this abstract adhere to the submission guidelines as listed on the website? So that's where you're looking for the subheadings, for the 300 words or less, for a title, which is 15 words and less. So those sorts of things. And then we do ask the reviewers to note any comments. So sometimes we can see, oh, that's fine, Natalie, no worries. I'll just make sure, sorry, I'm just monitoring if anyone else is dialing in, but they're not. So we will follow these three criteria. So you will get a score out of 3 for each one. So a total, you will get a total score out of 9. And then, as I say, you will be reviewed by 2 different reviewers. And so your total score will then be out of 18. And then what I see is a whole Excel spreadsheet with however many abstracts have been rated by all of the reviewers. And we start to look at how well the abstracts have been rated and roughly what their stream might look like. Like, do they sit in pediatrics? Do they sit in acute care, for example? And that's how that then builds the program. So it's done very fairly, and it's not done based on name as such. So it really is looking at your content, the quality of your content, the way it is presented within the abstract, and then if they're high rated well, they then get put into the program. Some people, you still have the option of saying whether you want this to be an oral presentation or a poster presentation. And if we get a lot of well-performing abstracts and we don't have room for all of them, we would always offer you the opportunity of a poster presentation if that was of interest. These following questions are still aspects you will need to consider, but you're not rated on. So does the abstract belong in the theme it was submitted under? So that's where our reviewer might say, no, they've said it was aged care, but we think it should sit in a different section. And the final recommendation, so the reviewer will say they either accept for oral, poster, or not accept. So really, I think if you follow the guidelines, you try to write with a really clear and relevant message, I really think you're likely to hopefully have a successful abstract. So what I wanted to do was show you, and I know these are, again, quite busy slides, but these are some of the abstracts that performed really well in the 2022 conference. We did have slightly different guidelines. So they were allowed 350 words. This time it's 300 words. And some of them have slightly different subheadings. So just be aware of that. That's a difference from 22 compared to 24. So first of all, with thanks to Alison Bowers, who's a research fellow at the Queensland University of Technology. She submitted this, and she actually was the highest performing abstract submitter, and so she got an award at the conference. So you can just see, I won't read through all of it, but I'll let you do that. I'll just give you all a minute to just read through without me talking. Has everyone had time to sort of read that? I think when I was reading it, I thought what sort of struck me was that her sentences are very quite specific and simple, so they're quite easy to read. She has nicely introduced, given us that background about why is her study important and relevant. She's obviously gone through the methods and results really nicely, and also tied that up as to how does that imply, like what are the implications about this for our future practice or future research. It's written in a nice way, it's structured well and so forth. So I think that just kind of gives you one way of structuring an abstract. This is an abstract from Anna Nicholas, who's a clinical nurse consultant at the Royal Hobart Hospital in Tasmania, and she is also a member of the Palliative Care Nurses Australia Committee. So Anna's written about a quality improvement project, and hers was also well rated. So just, I'll give you a moment to read this. So again, I think with this, you can see it's very clear as to why this is important from Anna's background. You can see very clearly what she's hoping to achieve with this presentation and what she did in practice when she actually implemented this new procedure and where she hopes this will lead to. Here's another one, which was from Associate Professor Anne-Marie Hosey, who is at Notre Dame University as an Associate Professor in Palliative Care. She also is doing a research study. And again, you can see how I think research work really is quite easy to fit into the headings that we have. But I think I would again just really emphasize the need to set in your background why this is relevant and important, and then be very clear in your aim as to what your work is or what your project is trying to achieve, the methods used in relation to that, and then what have you learnt from that? What are the results, discussion, and conclusion? And I've given my thanks to myself for this one. So this was one of mine that got rated reasonably okay. Again, just remembering we had a few more words, but so again, it's just that globally there's a growing imperative to involve consumers and consumer representatives in service redesign, research and implementation programs. So understanding how to do this meaningfully is important. So let's set the scene. What was the aim of my work? How did I do it? What were the results? Then sort of reflecting on what does this mean for practice policy research? So what are we going to do with this information into the future? So a few questions that have already come to us as the Palliative Care Committee are, I really do want to present on my quality improvement project, and is this suitable? Absolutely it is. The way we're seeing the titles and how they apply when you're looking at quality improvement is background. So why is this relevant and important? And you saw that reflected in Anna's work about the number of deaths in Hobart hospitals and so forth. What was the aim of your project, or what was the aim of Anna's project? So if you're thinking about a quality improvement project, what did you seek to achieve with doing that work? Your methods, what did you use? How did you design this change and how did you drive it? So did you, for example, if you introduced a new leaflet on the ward, did you do this with a particular process? Did you have a working group? Did you use champions? What was your process to try and enable change that you used? What happened when you tried to do your project? Did it go well? What, all good and bad outcomes are really helpful, I think, for all of us to learn from. And then from a conclusion point of view, what did you learn that's important for the audience to know about? Thinking reflective of the fact that our audience is predominantly nurses across Australia, working with people who have palliative and end-of-life care needs, whether they are in aged care community or hospital settings. So we get a very broad audience. We will have some online and some face-to-face. So what is important for that audience to know about? So for me, working in research, I often think the real nitty-gritty of my research design may not be the most relevant thing that I need to tell this audience. Actually, what this audience might need to know can be about how can I apply what you're telling me in my clinical practice, those sorts of things. I've also been asked about, can I present a case study, a clinical case study, and is this suitable? Again, yes, we really believe it is. The background, why is this case study important? So what is the relevance for us? Why should we be listening to this? The aim, what is the aim of you presenting this case? So did something go really well and we want to highlight that and we want to learn from that, or did something not go to plan and that you've got some thoughts around clinical change that we might be needing to think through? From the methods, how did you actually write the case study? So was it just personal reflections from you? Did you go back to the clinical record and actually take out some key pieces of information? How did you collect the information that you're now presenting? The results would be the case study itself. And then the conclusion, we were thinking, should really focus on what should change in the future as a result of us listening to this important story. So what are the implications for practice, or what might the implications be for research? And another question I've been asked is, that they were keen to present their story, their study or their project, but it's not completely finished, but it will be by August. So is that appropriate to put in an abstract now that are due in early February if you don't have all of your data? And we're again saying yes. So your background, aim and methods in that instance should be pretty easy to write because the study is underway or the project is underway. In terms of the results and conclusion, rather than just writing the study is underway and these will be reported in August, we would suggest that you actually write something in there like, so to provide some preliminary results available at the time. So what have you already achieved? So you could sort of say, preliminary results related to the 20 surveys that have been collected, data collection and analysis is still underway, and we're hoping to report on a X number by August. So certainly don't make anything up, but I think it is really helpful to note that you already do have some information, and that helps the reviewers rate that scientific merit component of the criteria, rather than giving you a 0 because they can't see anything. They can say, yeah, okay, well, we can see it's almost there, which is great. Same thing with the conclusions, like what do you anticipate from your study? What do you anticipate your project will inform? And again, I would very clearly note within that these are preliminary conclusions awaiting final data analysis and recommendations. Some final tips as well before we start to move to just a conversation with all of us. So proofread your abstract. A lot of abstracts that come through do have typos and all those grammatical errors and those sorts of things. And there is that presentation criteria. So that is 3 of your 9 marks. So you do want to try and do as well on that as you can. Try to engage the reader and grab our attention. I think when you look at some of those well-performing abstracts, they had quite simple, punchy sentences, not very long, convoluted ones, but ones that were easy to read and go, yeah, that's important. That's interesting and relevant and important. Have a look at our overall conference theme about clinical relevance, connection and culture, and try to make sure that your work is sort of within those spaces. And I always think it's quite useful to ask a colleague to read an abstract and provide some feedback. There's so many times I've done that with my work where I have thought that it made complete sense, and this person just writes back and goes, I have no idea what that sentence means. And that's just really helpful because we get so embedded in our work. And so it's always really useful for someone to have a read as well. So we're super excited to see your work and support your inclusion in the program. We are also very excited about the conference itself. If you have questions around the actual abstract submission and the portal and so on, I would direct them to that email, which is mail@conferencedesign.com.au. They're the conference organisers that we have working with us to help the conference progress well. If you're worried specifically more so about a particular part of your abstract, or if I can help at all with proofreading or anything, I'm really happy to do that. So feel free to just send it through. But also your colleagues would be able to, I think, help really nicely there. And now what I'm going to, just to let you know, you will get a CPD certificate as well sent to you after this. So you'll get a email with these slides and a CPD certificate, but I'm going to stop sharing my screen and just see if you have any questions at all, if I can successfully do that. I'll see if I can. I've got so many screens. So can you just see me again now? Just those of us online? Yep, great. Has anyone got any questions or comments at this stage?
I might just run by the idea that I've got.
Yeah.
So I work in the palliative care team, but my main role is supplying resources and education for aged and disability sector in my region. And so I work with someone else who split it's a job share across the Hume region. And we have identified an issue with people with disability receiving palliative care, and the people who are caring for them having no education or training around palliative care, and they don't even know where to start to find it. So we've actually developed a handbook to communicate to the aged care to the disability support workers, but also we find that the palliative care teams are often uninformed about what kind of resources are available in these homes. There's constantly getting the message that, oh yeah, you can do all that, but there's so little that they can actually do. So we've created a disability handbook. Is that something that would
absolutely
sort of tick the boxes?
Yeah, so that would sit within one of those improvement project abstracts. So you would start again. So the background would be noting your what you've said around the lack of people understanding the needs of that particular patient group, and that you identified this particular problem. So your aim is to improve knowledge around supports available for people with disability in their particular setting. Your methods then would be how you went about developing that actual resource that you've developed. Like, how did you convene that? How did you find the key pieces of information to sit within that? Your results are that you've got this fantastic resource and a little bit of information about that resource, and that's what you want to share with the conference. And your conclusions might then be around that aspect of what might be implications for practice, which is, I guess, implementing that resource, but also what else might we need to think about into the future to improve care and access. Yeah, so I think that would fit beautifully. Yeah, great work. Nice to hear about it. Any other thoughts or questions? Holly.
Yeah, hi Claudia. I've got Katie here who job share the NUM role. We're at a palliative care unit in Melbourne.
Yeah, you won the big award, didn't you? Not that long ago.
Yeah, we did. Yeah. The team did. Yeah.
Fantastic.
Thank you. I'm a little bit frightened by 300 words. I'm not going to lie. I could talk the leg off a chair.
Yeah.
With the authors and affiliations, is that included, or is it 15 words for title and then just 300 for the abstract?
Yes, that's right. Yeah.
Okay, great.
And it is really hard, but it is really hard to get to 300 words, but it is like you're going to have to do it like that. You will get rated in line with it.
Yeah.
So I think write what you're wanting to write, and then go back and just pull out anything that's superfluous, even though you might passionately love that sentence. And I, having not that long ago done my thesis, and I can see Philippa online too, like there are so many times I was like, no, but you have to have that, but actually you don't. But just keep coming back to what's going to make this seem interesting and relevant. What gives us, we need to understand the aim, and then really key information about the methods, results, and discussion, knowing that you will expand on all of that in the presentation. So that's where you just need to get in, and then you can talk the hind leg off, as you say.
I think ours is lived experience, so I was struggling because it's more narrative around experience, to put it into point form method result. You know, that's probably going to be tricky.
And are you thinking like clinical case study or?
No, we're thinking about shared learning around challenges and complexities and successes of provision of VAD in a palliative care unit.
Fantastic.
So
okay.
really looking at where we started 3 years ago as the law changed, and what we thought would be our main focus of concern and support, being palliative care specialists, has actually shown not to be that in an actual case. Just through 3 years of experience and team development, it's quite different, and it's sort of shifted. And I know that, you know, VAD is becoming legal in other states at the moment, New South Wales, especially South Australia. So just looking at what we can share in terms of what we've learned and how different it was to our initial assumptions.
So it's like
so it's tricky.
reflection on care provision over a period of time in relation to VAD.
Yeah.
So I guess your background will be what you said, like the jurisdictional law changes are now national, and really how to do this in practice remains really complex. Your aim, I'm just obviously talking off the top of my head, so please ignore anything, but the aim would be to reflect on 3 years of VAD provision within Victoria from your settings point of view. So be like just looking at yours, perhaps. Your methods then, would you be going back to look at the cases of the patients who you've supported, or?
We can. We also we can show survey results from staff around what they found to be challenging and successful in that process as well.
Which I think that would be fine if you've already done the survey. Have you done that? Or
no,
not yet?
But I mean, we can.
Yeah.
That's an easy survey to do. We're a small team of 30 people, and that can be done very quickly.
Yeah.
It's just through lots of staff meetings, conversations, ethical discussions. We have a very open communication around VAD in our team.
Yeah.
And so, hasn't been that formally structured.
So your aim could be to reflect clinician views and experiences in relation to VAD in your setting. I mean, you'll have to write it more nicely than that, but, you know, so you're reflecting the clinical team's perspectives. Your methods you can list, you know, MDT discussions, all those different things. And you could list, if you do a survey, list that in there. And then your results would be what your key kind of areas are that you're seeing emerge from those conversations. And then what your conclusion would be is like, what does this mean for VAD in your setting into the coming years, and what might other people in your, so you're in the acute care setting, I guess. So like, what learnings are there for those of us, for example, in Queensland or anywhere else? Like, And just informing for us, it's informing how we support staff moving forward, knowing that, you know, the needs have changed. Yes.
Over that time.
Yeah. I think it would be a great presentation to hear. I know it is more complex when you don't have just a straightforward project or study, but I think that I know the rules from what everyone's talking about in terms of the reviewers. They are absolutely going to look at those titles. So just try to make it work in there. Yeah.
Okay. Yeah. See how we go.
Yep. That sounds great though. Yeah. Any other questions or thoughts? No? Is that sort of helpful, the information? Is there? And again, if I know there was a few other people that had registered to come who've not been able to. So if you've got a colleague who wants them and you want to forward on our slides, please feel free. That's fine. We do want to try and make it really supportive and inclusive for this conference. And I know a lot of us as nurses, even very senior nurses, get really anxious about presenting in conferences. And but I was talking to a nursing unit manager the other day who's managed for such a long time, and they're such an amazing senior nurse. they're like, no, I could never do that, but they're doing such amazing work. It would be great to get them to do so. So we really do want to try and support people to have that chance. Well, I won't take more of your time, but please do feel free to reach out to me by email if that's helpful. I don't know if my email was around. I'll pop it quickly in the chat for you all. Claudia.Virdun@flinders.edu.au. But as I say, I'm not the font of all expertise in abstract writing, but I'm very happy to help if I can. But you'll have other great colleagues who'll be able to give you really good feedback as well. So feel free to stay in touch as is helpful. Thanks, everyone.
Thank
Thank
you.
you. That was excellent. Thank
Thanks,
you.
Claudia.
No worries. Thank you.
Thank you.
Bye.
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 Thank you.